Hey everyone, I am back today and I'm going to be doing the ICD-10-CM updates. I know it's actually past October 1st, and I was going to skip out on them, but I just got so many requests that they said, hey Victoria, we know that we can get this information elsewhere, but we'd like to hear it from you. So today I'm going to go over the ICD-10-CM updates. If you need the guideline changes, I did do a separate video about the guideline changes. You can check that out over here. So here are our ICD-10-CM code changes that were in effect for October 1st of 2021. Hopefully by now you do have your ICD-10-CM 2022 book. So ICD-10-CM and PCS update October 1st of every year. So every October 1st, there's new codes added, there's revised, and there's deleted codes, and it depends on the healthcare community needs and the changes that we need in the data. For the purposes of this presentation, a lot of the stuff that was revised this year wasn't really noteworthy of going over. Like one of the changes they made was spelling of the word Portuguese. So some of the revisions aren't really going to impact code selection in any way. So I'm going to skip over pretty much all the revisions because none of them are really impacting code selection. There were some deletions. Primarily the deletions were because they now have a more specified code. So they deleted the code that did not have the appropriate character extensions. And there were a lot of additions this year. Changes are proposed and discussed at the CDC ICD-10-CM Coordination and Maintenance Committee for future revisions, and that's actually publicly accessible. You can access all of that online. So if you're ever interested, you can read all of the different proposals that are submitted. Usually they're submitted by like medical societies that they need better tracking of certain patient outcomes or scenarios, or they want to have more specificity, or it's defaulting maybe to a code that is not specified for a certain condition and they want something that is specific for that condition. They don't want it to go in kind of a generalized category so that they can track that and determine appropriate treatments. They are public meetings, so if you're ever interested in attending them, they do have all the information on the CDC website. So if you're ever interested in the rhyme or reason, or you want to propose some ICD-10-CM codes, you want to check out the CDC website. That's where you can find all the information pertaining to that. So for our chapter 1, we have code A79.82 was added for anaplasmosis. So this was added because they want to be able to monitor this particular disease and how it is spreading, and then possibly develop some prevention measures for anaplasmosis. In chapter 2, there weren't codes for malignant neoplasms and secondary malignant neoplasms of bilateral ovaries. We had right and left, so we had to use 2 codes if they had bilateral, one for right, one for left. And now they were requested to have an additional code for bilateral neoplasms of the ovaries. So those were added in, as well as C84.7a, which is for anaplastic large cell lymphoma, LALK negative of the breast. This was actually submitted by the American Society of Plastic Surgeons. They requested to have this code added because this is seen more so in the plastic surgery setting, because ALK of the breast is associated with implants. It's not actually a disease of the breast or of like the lymph nodes near the breast. It's actually surrounding that capsule of a breast implant. So they want to be able to have more data regarding that specified type of lymphoma. So that's going to help a lot with the needs of that society of tracking those types of cases. For chapter 3 are diseases of blood and blood-forming organs and disorders involving immune mechanism. We have 2 different codes for anemia. We have some specified differences between thrombocytosis. So now we have other and we have an unspecified. And then we also have hereditary alpha tryptosemia. So for our anemia codes, there was a lack of kind of centralized reporting of this disease. And because of not having that tracking, it's been harder to identify some of the lifelong complications related to this disease. So now providers are going to be able to better track that follow-up that's needed with those patients and all the different complications that they may be later developing as a result of this disease. Chapter 4, we only saw 1 code update. So Niemann-Pick disease type AB. So it's a rare and potentially life-threatening lysosomal storage disorder. Previously in ICD-10-CM, providers would have to choose either A or B or an unspecified code. And essentially, in a way, they had to kind of misdiagnose patients because there wasn't a classification for type AB. Chapter 5, there was a pretty significant change. So if you're familiar with the ICD-10-CM guidelines, if you were to look up depression, there previously was no unspecified depression code. It would default to major depression single episode, which really wasn't clinically correct. So now we have an unspecified term to, instead of it going to that major depression single episode where it previously did, now it will go to the default of depression unspecified. So definitely some changes that had to be taken there with electronic medical records and some of the mapping as far as how to code for depression. And we also have the new code F78.A1 for SYNGAP1 related intellectual disability. SYNGAP1 is actually a gene that has been found to be related to intellectual disability, and it's also frequently associated with other disorders, including epilepsy and autism. We have some changes in Chapter 6, diseases of the nervous system. So GO482 is now acute flaccid myelitis. And what was happening is that main term myelitis had that like a non-essential modifier, something that was in parentheses that said acute, but it didn't have anything really relating to the flaccid component of it. So now we have that extra specificity there for the acute flaccid myelitis. We have codes now for cervicogenic headaches, as well as our immune effector cell-associated neurotoxicity syndrome, and now they're graded. So the grading is really the intensity of the condition. Having the diagnosis codes associated to stage is really going to help hospitals and clinicians give the explanations of why there may have been a different patient care delivery, why they may have had different resource consumption, why they may have, been in the ICU, for example, or gotten more complicated drugs because they're at a higher grade. And now we also have a different code for relations to encephalopathy. We have other toxic encephalopathy and unspecified toxic encephalopathy. So Chapter 9, diseases of the circulatory system, has added I5A, which is our non-ischemic myocardial injury. So we had quite a number of changes to Chapter 11, diseases of the digestive system. And so ICD-10 had classifications for non-adenomatous or hyperplastic polyps, but there weren't unique codes for esophageal polyps or esophagogastric junction polyps. So now we've got two specific codes for that. The American Gastroenterological Association requested new codes to develop and define the types of gastric intestinal metaplasia. So we have like without dysplasia, with dysplasia, the different grades of dysplasia. So a lot more specificity now that is more unique. Chapter 12, we've got some new codes in relationship to basically moisture-associated skin damage and the different types of reasoning for that moisture-associated skin damage. This was requested by the Wound and Ostomy Continence Nurses Society. So now it defines whether they've got this irritation on the skin because of fecal matter, because of saliva, because of some sort of stoma-related conditions. Assumedly, if it's something that's maybe related to a stoma, you may also want to look at some of those codes that are complications of the stomas. So something to consider. These are going to definitely improve some of the data related to these specific conditions and the causes, and then hopefully again develop some preventative measures. Chapter 13 had some new codes added as well, and I'm actually Googling how to pronounce this one because I want to make sure I say it correctly.
Sjogren's syndrome. Sjogren's syndrome.
Sjogren's syndrome. Sjogren's syndrome. Don't ever be afraid to Google how to pronounce things because I do it. I am just as guilty as anyone else. Sjogren's syndrome is a chronic disorder of the immune system, and it's an autoimmune condition. So the healthy tissues and cells are mistakenly attacking the immune system. If you looked up syndrome and then Sjogren's in ICD-10, you wouldn't find anything. But under Sjogren's, it does say, see Zika syndrome. And this was in our 2021 version. So it wasn't really an appropriate code. And now we have a lot of specified codes. So if we look in our 2022 book, under it's now under syndrome and then Strogan's. That's where you'll find it in your alphabetic index, and you can see all of the additional specificity now that has been added. So we have our default code here, and we also have all of the more specified widths. And also, if you remember our guidelines in ICD-10-CM, anytime we see this term width in the alphabetic index, what do? We assume a cause and effect relationship unless there is provider documentation specifically stating that they are not related. We also added some codes in Chapter 13 for non-radiographic axial spondyloarthritis, and it's a potentially severe chronic inflammatory arthritis that entails significant back pain and impairment in spinal mobility and physical function. So the codes now are going to break down also between the locations. So you can see here we've got the thoracic, we've got thoracolumbar, we've got lumbar, lumbosacral, sacral, and sacrococcygeal, and then multiple sites. And then we also added in a couple of different specified codes for low back pain versus vertebrogenic low back pain, and then other low back pain. Chapter 16, we had some new codes added specific to abnormal findings on neonatal screenings, and these were proposed by the American Academy of Pediatrics because they have a lot of different mandated screenings, particularly on the state level, for looking for things like metabolic conditions, endocrine conditions, hemoglobin conditions, and other things, and they wanted to make sure that they had appropriate codes to designate when they're doing these screenings and they find something abnormal in that screening. So that way they can track what's going on with these abnormal findings and if they wind up resulting in some sort of further definitive diagnosis. You know, a lot of times we hear things like billing and coding, and we think that coding is just a billing concept, but really it's not. If you look specifically even at just these ICD-10-CM proposals, a lot of them are driven because providers need specific data, not because they're like, hey, I need this code so I can get this paid and I have to bill it out with a more specified code. It really is that they're trying to track the data better. Chapter 18, cough was a pretty big change that people are looking at. We have codes for acute cough, subacute cough, chronic cough. If it's less than 3 weeks, we usually consider it an acute cough, and we want to kind of change the parameters around coughs, because now if we're having a patient who's just coughing, we can track between, is this an acute cough because they had an upper respiratory infection, or is this something significant that they have a chronic cough and we wind up finding out, there's some kind of long-term problem going on with this patient. We also have some differentiations now with our self-harm codes that we have now specified non-suicidal self-harm. I think it's important to designate that certain types of self-harm are not meant to be a suicide attempt, that maybe they're done because of a coping mechanism or emotional problems, anger, frustration. So I think it's important now that we have those differentiations, and then we have some other personal history codes that we'll look of too related to this particular change of the self-harm. And then we also have some codes that are related to pediatric feeding disorder, and that can be described as an impaired oral intake that is not age appropriate, and it's associated with medical, nutritional, feeding, skill, and or psychosocial dysfunction. You can also see here we have a couple of new codes, R3581 for nocturnal polyuria, R3589 other polyuria, and even the R709.83 code for abnormal finding of blood amino acid level. Now, brain compression and herniation occur when brain tissue, cerebrospinal fluid, and blood vessels are moved or pushed away from their usual position inside the skull, and the pressure resulting in such movement can be due to brain swelling from a head injury, stroke, brain tumor, abscess, hydrocephaly, or other underlying cause. So traumatic brain injury is one of the most common causes of brain compression and brain herniation. So we have now these SO6AOX codes for traumatic brain conditions with or without herniation, and of course our ADS for initial, subsequent, or sequela. Now, if you look at this next slide, I kind of left the blanks there for our 7th character extensions for the A for initial, D for subsequent, or S for sequela, only to kind of save some space here on the slides. Now we have some additional codes for cannabinoids and synthetic cannabinoids, and they're called cannabinoids because they act on the same brain cell receptors as THC, which is the main active ingredient in marijuana. And we are seeing a heightened use of these synthetic types of drugs. Some of them, because of their compounds, are considered legal, but legal doesn't always necessarily mean safe, right? And then in our external causes, we just had this one addition, which was our Y35899, which is the legal intervention involving other specified means, unspecified person injured. So a pretty unspecified code. In Chapter 21, we saw a lot of new codes pertaining to social determinants of health, new status codes here. I've talked in the past about social determinants of health. One of the steps that we're trying to take in population health management is trying to determine what patients are facing in their lives that may lead to poor health outcomes, things like homelessness, things like food insecurity, things like not being able to afford their medication. So because of trying to look at different quality outcomes even and understand why, maybe if a provider was doing all of the right things, that patient still had a bad outcome, what are those involving factors in that? Well, now we're tracking that a lot more through things like social determinants of health, which are a lot of these codes here. You can see things like the patient had food insecurity. They are having housing issues. They're homeless. And now we're differentiating even between a sheltered homelessness and an unsheltered homelessness. And then we also have this new code, Z91.014, which is our allergy to mammalian meats. And we have some new personal history codes. Remember, we talked about that self-harm, the suicidal versus non-suicidal. So we've adapted those personal history codes related to that as well. We've added some personal history codes for chimeric antigen receptor T cell therapy, for other cellular therapy, unspecified cellular therapy, and then personal history of gene therapy. And last but certainly not least, U09.9, our post-COVID-19 condition unspecified. And I did talk about those changes that we have to the COVID-19 codes, our Chapter 22 codes for special purposes, especially related to our COVID-19, because right now we just have COVID and vaping in that category. If you want to see the guidelines video related to that, this is the video you definitely want to check out. I will see you guys in the next video. And until then, just keep on coding on.